Dr. Glen Beneby, medical advisor for the Public Hospitals Authority in the Commonwealth of the Bahamas. And I'm here as a part of the team representing the Bahamas to deal with medical tourism. Indeed, the team from the Bahamas on this particular occasion is being led by the Ministry of Tourism. So I have come in a supportive technical role in terms of my medical expertise. I also have relationships with other organizations in the Bahamas that are involved in medical tourism. Well, medical tourism is so important because it creates a number of opportunities for people throughout the world. By its very definition, medical tourism means the treatment of persons outside of their domicile, place of residence or stay. So often we think about it in terms of geographical boundaries, but it involves treatment within geographical boundaries as well as across geographical boundaries. And once you have that kind of opportunities available to you, you can see immediately there are national, domestic opportunities, there are international, global opportunities. And in the world as we now face it, North America being the leader in technology, also the leader at this moment in reform, creates, because of that, an interest in health, medicine, and tourism that hitherto has not been experienced.
Very good. As you see it, how fast is the medical tourism industry growing?
That's a very difficult question because it depends on where you are. It reminds me of a statement that says, your view of the city is determined by where you stand on the mountain slope. And to different persons, the perception will be different. Certainly in developed countries that have been involved in medical tourism for many years, there's an increase in the medical tourism. But the view of that increase is different. And the reasons for that increase is different from the reasons that are seen in developing countries and in Asia and in Latin America and other countries. So when you ask that question, it depends on where you're looking at the city from on the mountain slope. So I look at it from where I am placed, and that is in a developing Caribbean country with a proximity to North America that is unequal to any in the world. Other than those countries that are contiguous to North America, the Bahamas is the closest non-contiguous country to North America. And we have a very extensive tourist industry. At our best, 5 million tourists come to our country with a population of 350,000, an archipelago of islands extending from the north in Abaco straight to Inagua. Of course, the level of visit and tourism is different. And it brings me to a point. For instance, in Cat Island, we have tourists that come to Cat Island to experience bathing in our lakes, which is to them almost a revival, a rejuvenation of their spirits. In the first world country under constant exposure, they get this break, they come down, and we consider ourselves the backyard. You can play and you can relieve your stress, and they come back rejuvenated. And then at the other extreme, we have the opportunity for research and development, where we can do things that have been approved in Europe and elsewhere in the world and awaiting FDA approval. And we're doing those types of procedures, the high frequency, intensity, urology, ultrasound procedures being done in the Bahamas. And there are so many, the spectrum of examples can go straight across the board. So often people think about medical tourism as high-tech, sophisticated tourism. That's not all the aspects of it. There's sports tourism, there's second homes where you have nursing and rehabilitative medicine, and the list go on and on. I cannot exhaust it in this interview.
Right. Are you excited about the opportunities in medical tourism?
Well, I'm excited about anything that is new. I'm excited about anything that gives opportunities for new ideas. I'm excited about anything where there's creativity. And perhaps it's the scientist in me that creates the opportunities that sometimes are not readily seen to other people through research and development. Medical tourism presents that. It gives you the opportunity to go to the bottom of the sea in countries like the Bahamas and view things that may be used to help in the development of cancer from at the bottom of the sea. It gives you the opportunity to be on land and to use some of our herbal medicines. And then it gives you the opportunity just to involve with first-class medical joint replacements, cancer treatment, a view that one can step into stem cells. And there are so many different opportunities. You can begin to appreciate that medical tourism has in it, and it goes way back. It has a biblical root, of course, as you know. From biblical times, people travel to have care, and we've come right straight through. This is not a new concept, but it's a modern concept. It's a revived concept that because of technology now, we can do things that we couldn't do before. And the Bahamas, being next to North America, is well poised to take its place.
Okay. Well, I know it's a little early, but what do you think of the conference so far?
Well, you said it's a little early, but it's had an immediate impact on me already. I've had just a brief opportunity to walk around. There's a diverse atmosphere in terms here of people from all over the world, North America, Europe, Asia, all coming together. We've had discussion this morning from OECD countries, from Pan American Health Organization, and I was privileged to be in on a conversation with the ministers from the Caribbean and elsewhere. You begin to see so many commonalities, but as you look at the commonalities, there are differences or niche opportunities that you can pull out and say this is something that is better served in this jurisdiction, something that you can have opportunities for collaboration. There's synergism here. If we do this here, we do it here. And the Medical Tourism Association has placed itself in what I would call a position to sort of a network and bring all of these things together. And I heard the president speak at the table this morning, and one must be impressed with her comments. Already, the role of international bodies, particularly in highly structured professional organizations, and medical tourism, by its very nature, will call on a high degree of technology advancement in various sectors of the society, physician bodies, data management, healthcare workers at various levels, and of course the hospitality industry as well. So what medical tourism has the potential to do, Medical Tourism Association, is to find a common ground that they behave as a vehicle to network that information, to cross-fertilize, if you want to put it, the information from various groups. And what I've found it to me to be of great value is that it has gotten the attention of policymakers, people who can really drive an industry. You know, when there's the individual one or two persons speaking about health tourism or medical tourism, you don't garner the attention. But Medical Tourism Association has managed to attract the attention now of policymakers, of ministers, of Pan American Health Organization, of World Health Organization, in the IDB and OECD countries. And it's beginning to play that role of facilitation that a private sector organization, or perhaps I ought to reword myself and say an organization with civil society backing, can do better than a government organization or purely private sector organization, because it provides a linkage between the various sectors. I speak as an advisor to the Public Hospitals Authority of the Commonwealth of the Bahamas, and what I can say is that we are well poised to develop medical tourism. We are strengthening our infrastructure. We are strengthening the manpower that we need to do this. We are facilitating the private sector with policies and incentives that will allow them to be in an environment that is enabled by our government. And we believe that we are bringing together the components that we need to be able to begin to tap into the various niche environments of medical tourism. It is not a singular effort. It's not something that will occur overnight. It's something that needs thought, and we look at it as we are going to be providing value. Value is directly related to quality and inversely related to costs and inefficiencies. So we have to improve our efficiency, look at our costs. We want to get it right, and we'll have our quality right. Thank you.